Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. Our topic today is how saturated fat promotes inflammation. We know that chronic inflammation plays a key role in promoting and worsening arthritic conditions and autoimmune diseases, as well as cardiovascular disease, Alzheimer's disease, and cancer. In my own clinical practice, it became very apparent that a person's diet and lifestyle plays a really important role in the inflammatory process. Patients with better diet and lifestyle behaviors tend to recover better from joint injuries and are generally able to manage various inflammatory conditions over their lifetime. So for many years we've known that the polyunsaturated fat known as arachidonic acid that's found in high concentration in meat products is converted by the body into inflammation-promoting hormones known as prostaglandins. So more specifically, prostaglandin series 2. So when you take an aspirin or ibuprofen or Voltaren or Celebrex, these drugs are reducing inflammation by blocking the conversion of arachidonic acid into prostaglandin series 2. That's how they work. And so that's how important arachidonic acid is to the inflammatory process. So if you eat less meat in the first place, then you'll have less arachidonic acid in your body to start with, and you generally produce less of the prostaglandin series 2 prostaglandin that's related to inflammation. Now, in recent years, we've seen that. In addition to that, saturated fat also increases the inflammatory process. So there's a spectacular review paper on this subject that was published in 2015 in the journal Advances in Nutrition, which is published by the American Society of Nutrition. I'll show you this article. And you see that the title of the article is The Science of Fatty Acids and Inflammation. It's really eye-opening. So the first finding of importance is that in the gut, in the large intestine, there's all these bacteria that live there. There's trillions of these bacterial cells that are there. They're supposed to be there. And some of them are gram-negative bacteria and some are gram-positive. But the gram-negative bacteria are known to produce certain types of toxins that we call endotoxins that are sort of part of just what they do. And studies show that when we have a lot of fat in our diet, the fat actually carries those toxins into the body, and there's more toxins now in the bloodstream. So studies now show that a high-fat diet carries more of these bacterial toxins into the bloodstream than a lower-fat diet. And once these toxins are in the bloodstream, immune cells in the body respond to these toxins by secreting all kinds of inflammatory chemicals called cytokines, which increase the level of inflammation throughout the entire body. So that's the first finding. The second finding is this, that saturated fats, found particularly in meat and dairy products, including butter, these particular saturated fats, stimulate a receptor on the surface of a very key immune cell called the macrophage. So on the surface of the macrophage, there's a receptor. It's called the toll-like 4 receptor right on the surface. And once stimulated by these saturated fats, the macrophage cells secrete a host of very powerful inflammation-promoting chemicals or cytokines that are known to contribute to and aggravate joint and muscle inflammatory diseases, as well as diabetes, cancer, heart disease, and other degenerative conditions. Now, by comparison, olive oil, which is rich in monounsaturated fat, and omega-3 fats from fish and fish oil and flaxseed oil are shown to inhibit the release of inflammatory chemicals from these macrophages and other immune cells, thus toning down the inflammatory response within the body. So, in recent videos, I've explained how eating too much saturated fat increases the production of the bad cholesterol, the LDL cholesterol, which is linked to heart disease and so on, and how saturated fat also promotes pathways linked to cancer development, particularly in recent studies, breast cancer and prostate cancer. So this 2015 review article in the journal Advances in Nutrition now explains how too much saturated fat also increases inflammation within the body, which is strongly linked to risk and aggravation of arthritic conditions and diabetes and Alzheimer's disease and other neurological diseases, cancer and cardiovascular disease. These saturated fats of greatest importance are found primarily in high-fat meat and dairy products. So I think it's one more reason to be very vigilant with your intake of saturated fat from these particular food sources. So until we meet again, I'll encourage you to eat smart, live well, and I know you're going to look and feel great. Thanks for watching.